So our first pathology is an ectopic pregnancy. An ectopic pregnancy, also known as an extrauterine pregnancy, is a disorder that occurs during pregnancy when a fertilized egg implants outside of the uterine cavity and then begins to develop. The fallopian tubes are where the egg most commonly implants itself, and this is called a tubal pregnancy. An ectopic pregnancy occurs in 1 in 100 pregnancies. Some of the signs and symptoms include any early pregnancy signs or symptoms, which could include morning sickness or a missed period. Some other symptoms include acute abdominal pain and light vaginal bleeding. If tubal pregnancy occurs, the fallopian tube that the egg is implanted on will become distended and can lead to blood vessel rupture and internal hemorrhage. And if this happens, then it may cause fainting and shock to the mother. Here we have an example of a normal pregnancy, and you can see here that the egg has implanted itself within the uterus, and then an example of an ectopic pregnancy where the egg has implanted itself on the fallopian tube. There are a few options for imaging modalities. Quantitative serum human chronic gonadotrophin test, or an HCG test, is a blood test used to determine whether a woman is pregnant or not. This test is performed to ensure that the patient is in fact pregnant while experiencing any of these signs or symptoms, and then they will conduct further testing after that. A transvaginal ultrasound will be the next step. A transvaginal ultrasound is performed by having the ultrasound probe placed within the vagina while the test is performed, and this is done to confirm the diagnosis and to determine the exact location of the ectopic pregnancy. And lastly, MRI is another option and can provide additional information on the location of the ectopic pregnancy. The treatment for an ectopic pregnancy is the removal of the ectopic tissue or the affected uterine tube. And this can be done through laparoscopy, which is a surgical procedure using the laparoscope, which is a thin tube instrument that has a light and a lens to view and perform the surgery. Another option is medication. An early ectopic pregnancy can be treated by using methotrexate, which is a drug that stops cell growth and then dissolves the existing cells. And lastly, abdominal surgery. This is a surgery to remove the ectopic tissue or the affected uterine tube. An ectopic pregnancy is always fatal to the fetus, and if it's not treated quickly, it can quickly become fatal for the mother also if internal hemorrhaging does occur. And here I have some. The other pathology we're going to be talking about today is placenta previa. Placenta previa is when the placenta implants in a position that covers parts or all of the cervical opening. There are 4 defined degrees of previa depending on the location of the placenta. There's total or complete, which covers the entire opening, partial, marginal, or low-lying, which only covers parts. Due to the partial separation of the placenta from the uterine wall, painless vaginal bleeding will occur in the later stages of pregnancy. Most cases of placenta previa will be diagnosed at the routine sonography appointments. Sonography can determine the location of the placenta and it monitors the fetus. Sagittal MRI imaging is not usually required, but can provide further information on the location of the placenta. There is no medical treatment for placenta previa, but doctors try to limit the amount of bleeding the mother will experience until the baby can be safely delivered. In the case of a low-lying placenta, it is very common and tends to resolve itself as the fetus grows. But if the mother has a more serious degree of previa or it can't resolve itself, a C-section will be required to prevent the mother and fetus from hemorrhaging.